A counselling service based in a GP practice in County Antrim has been told it can no longer operate due to a change in tax laws. One of the therapists at the main medical practice in Ballybackie is now worried about the impact this will have on people's mental health. Maria McCann reports.
Brian's been working as a counsellor at the main medical practice for 6 years, but a change in employment rules means that's coming to an end.
People aren't going to know where to go for that help. And their main port of call is the GP, who refers on to the counselling service. Well, that's not going to be there, so they're going to place more demand on the GPs, and the GPs aren't going to have a service to refer to, so their only port of call is going to be increasing their antidepressant.
New tax laws came into effect in April, meaning businesses may be responsible for paying tax and national insurance contributions on behalf of self-employed workers. But the GP practice says this may make the use of in-house counsellors more costly and difficult. Campaigners are worried that if counselling services are being cut from this practice, that they may be also lost elsewhere. They say at a time when they're needed the most, this is a backward step.
You know, it's obvious now, coming out of COVID with the impacts on mental health, that this is something that's needed more than ever. So it's unbelievable to think at the worst of times that we'd actually be losing this vital mental health support service.
In a statement, the Health and Social Care Board said practice-based counselling services are not mandatory, and as independent contractors, GP practices have the choice to contract to provide this service or not. The board said it would encourage all practices to consider contracting for this updated service. It's not yet clear how many other practices have decided to cut counselling, but the clients, counsellors and GPs at Main Medical hope a solution can be found to resume there soon. Maria McCann, BBC Newsline, Ballybackie.